So we've completed in Module 4 the agreements over screening and the scientific support for mammographic screening to reduce breast cancer mortality and morbidity. The next module addresses the controversies in screening, including when to start mammography, when to end it, and how often should it be performed. The intended learning outcomes of this module include the ability to incorporate mammography screening guidelines into your clinical practice and to develop confidence in discussing these controversial issues regarding screening with patients. The Michigan Cancer Consortium has issued in May of 2014 guidelines for both average-risk women and high-risk women with regard to both clinical and imaging screening guidelines. The current guidelines for women age 40 and above is to have yearly mammograms, which continue until as long as a woman is in good health. The major clinical societies that issue guidelines recommending screening mammography, age to start, and frequency are listed on the left-hand side of the screen. The majority do recommend starting screening at age 40 and screening annually. However, there is some controversy with regard to that, as you can see, where the USPSTF and the AAFP recommend screening starting at age 50 and either biennially or every 1 to 2 years. The USPSTF issued guidelines in 2009 recommending screening biennially for women aged 50 to 74. Their recommendations stated against screening women in their 40s, and they reported insufficient evidence for screening with MRI or digital mammography. It's important to remember that the USPSTF guidelines only apply to women who do not have previous cancer diagnoses or at high risk for breast cancer. So these are for average-risk women. It was who the recommendations were for. The randomized controlled trials, some of the studies included women in their 40s, and this was analyzed by Nelson as part of the USPSTF reporting in 2009. And they reported a 15% reduction in mortality for women who are screened in their 40s, with the overall reduction of 0.85 relative risk compared to women who were not screened with mammography. Mortality reduction for women in their 40s was addressed also in the Canadian study that had been discussed earlier, where several Canadian provinces were analyzed with regard to their mammographic screening programs, looking at women in their 40s and comparing them to women in their 50s. Women in their 50s are in the accepted age range for screening across the board, whereas the women in their 40s are in the controversial age range. And this study demonstrated no significant difference in the mortality reduction of approximately 40% for both the women in their 50s as well as women in their 40s. And the conclusion was that women in their 40s should be screened as well as women in their 50s. The computerized models that have been used to look at screening women in their 40s include the CISNET analysis published in 2012 in the Annals of Internal Medicine, revealing a 51 life years gained per 1,000 mammogram screenings performed for annual screening. And this study was looking at what is the tipping point in favor of screening in the 40s? What would it take to make it worthwhile to screen women in their 40s? And they compared this to women in their 50s, 60s, and 70s, again, in the, quote, accepted age range for screening across the board. And they reported that if a woman's personal risk was twice that of a woman without risk factors, that was the tipping point where the benefits and the risks were balanced, and it was worth screening women in their 40s. So we've reviewed why there is recommendation in many societies to screen women in their 40s. Going on to the controversy of how frequently to screen. This data is a little more difficult to analyze because these studies, in large part, have been all over the map in terms of the frequency with which they've screened patients. The randomized controlled trials screened women at any interval from 12 to 28 months. In the United Kingdom, a standard is to screen anywhere from 1 to 3 years, and many of the modern observational trials screen either at 1 year or at 2 years. There are no randomized controlled clinical trials or observational studies that actually compare directly 1-year intervals versus 2-year intervals for screening mammography. So we're left with the computer model studies. A study performed in 2009, published in the Annals of Internal Medicine, revealed that the most lives were saved with a screening program beginning in the 40s, continuing through age 69, and screening annually. This resulted in a 30 to 35% increase in lives saved compared to a biennial program of screening. The efficiency of screening, however, was reported as being most efficient for women in their 50s, starting at age 50 and going on to age 79, and screening biennially. Efficiency would be considered the outcome per mammogram, but it's important to remember that the most lives were saved when screening annually, starting at age 40. A further computerized model put forth by Hendrick in 2009, reviewing the CISNET data from the USPSTF, demonstrated significant improvements in each decade of study of the women in their 40s, 50s, and 60s when annual screening studies are performed versus biennial screening. There was a 30 to 38% improvement in breast cancer lives saved from breast cancer death when women were screened annually as opposed to every other year. This effect was not as significant in women in their 70s and may be an indication for decreasing screening interval to biennially for women in their 70s, but that was not the case for women in their 40s, 50s, and 60s. Mortality reduction in the UK was demonstrated to be as significantly improved for women who were screened annually. As stated before, the custom in the UK is to screen age 50 to 70 on a triennial basis every 3 years. The mortality reduction was significantly improved when the interval of screening was increased to every year. And the mortality reduction increased from 16% on a every 3-year schedule to 37% when these women were screened annually. The third portion of the controversy in breast cancer screening with mammography is when to stop screening. There's no consensus on when to stop screening. There are no randomized controlled trials, and there are no observational trials to address this issue. Most of the studies that have been performed end with for women in their 70s, typically 74 or 79. In general, the consensus is to continue mammographic screening while the woman is in good health. It's important to assess comorbidities that may shorten her lifespan. And the accepted dictum would be to continue screening as long as there is more than a 5 to 10 year life expectancy. 10 years is where the follow-ups for mammography show that there's a significant benefit to mammography is after 10 years. So you want the woman to have at least a 5 to 10 year life expectancy to show the benefits of mammography. It's important to remember a perspective that we don't always think of is that a 74-year-old woman in the United States, of the 74-year-old women in the United States, 50% will live another 13 years and 20% will live another 19 years. And this is by actuarial tables. So you can filter that into your screening recommendations for women as they approach the later years.